This segment kind of makes me mad. I want to get you guys' opinion on this, and this is controversial. So if you don't want to like do a deep wade in, you don't have to. But we've talked about this before.
Yeah.
So this is a segment, and basically the segment is about this doctor here in the United States, which is refusing to publish government-funded research on puberty blockers for potentially political or personal reasons. I have big beef with this doctor. So the doctor's name is Johanna Olson Kennedy. She's a pediatrician. She's the medical director for the Center for Trans Youth in Los Angeles, which is the biggest trans youth clinic in the United States. I don't think it's the world, but I think it's the United States. And as I said, she is refusing to release some research. So I want to do like some background on this, because I don't know how much people know about the whole puberty blockers and how that came about. And it's kind of like a long story. And for the longest time, it got almost no, news exposure. And then in the past, maybe 5 years, it started. I mean, what do you guys think? When did we start hearing about this? It's been like, past 5 years? Less than that?
I don't know.
3 or 4?
Yeah, I would have said probably like 2, 3.
2, 3. It's been more recent.
Yeah.
And it's gotten politicized, which is, always bad. But I want to kind of do a little bit of background information on this, because, having more information is always good, right? It helps you make informed decisions. So as I said, this is news. I want to throw the news article up there first, Travis. This hit the New York Times yesterday or the day before. There's also one in the Washington Post if you want to do. I mean, I'm going to tell you most of the information in a minute, but that's the news article that I saw first. So the background. So in the past decade, puberty blockers and hormone therapy for as well as gender transition surgery has seen a dramatic increase in children, so less than 18 years old, when they have gender dysphoria.
Yeah.
And I've been a critic of this, and to be fair, I'm fully on board for any consenting adult that wants to go through gender transitions, whether it be the hormones or surgery. I mean, go for it. Like, you do it. If you're an adult and you talk to your doctor and you feel like this is what you want to do, I have zero problems with that. I do have problems with it in children, and just briefly why that is. I mean, one of my biggest issues is that they can't legally consent themselves, and this is something that is just absolutely life-altering.
Yeah.
The rates of desistance. So desistance is when someone has gender dysphoria, and then it goes away, meaning someone wants to change genders, but then they change their mind. So that's called desisting. So desisting rates in kids is not insignificant. And then my final gripe about it is the data that supports this, in my opinion, and in the opinion of other people as well, is very lacking. So I've been against it in kids. We've talked about that a few times. So what is the data that people are using for the use of puberty blockers and hormone therapy? Well, it actually comes from something called the Dutch study. So the Dutch study was actually released in 1996, like a long time ago. I got a snapshot of it. This is a reprint article of it. The original one came out in 96. This one, it was a reprint article from, I can't read the date. What's that date say, Charles?
2008.
Okay. So it's the same thing. They didn't change anything. They just released it as an article. I think the first one was actually in a book, like a medical textbook. So according to the Dutch study, they found that the mental health dramatically improved in children that had gender dysphoria that underwent puberty blockers. And because of this Dutch study, it started to gain steam first in Europe, where if kids had gender dysphoria, let's give you puberty blockers. And it gained a ton of steam, and it got really popular really quick.
So
and
that just makes them not go through puberty.
Correct. So
fast?
you're talking about a 10 or 11-year-old child that says, it's like, I'm a boy, I want to be a girl. And they're like, okay, well, the easiest way to kind of, make that happen is not let you go through puberty, right? Because when you go through puberty, you start to either get more masculine or get more feminine.
Yeah.
And so they block that. And it does do what they say it does, but it also has permanent life-altering changes. I mean, it changes how your genitals develop.
Yeah. Well, if you stop taking it, does your body revert back, or does it?
I mean,
never
it can try,
fully?
and then you'll have to supplement it, but it stops the natural flow of puberty, which is a potentially life-altering thing. It's not necessarily easy to go back. Once you start that and you block puberty, depending on how long it happens, it's not easy to kind of reverse that and get what the normal outcome would be.
Yikes.
So this got accepted, basically this Dutch study, without question throughout Europe. The governments were on board, the medical societies were on board. It then hit the USA, so Europe first, then the USA. That's whenever we started to see it being talked about more in the news. Of course, as it rose in popularity, you started to get critics of this. I myself, for the reasons that I talked about earlier, but like all the medical organizations seem to be on board. It did get political with the government and red, blue, and all that. But things kind of plugged along where this was kind of accepted. Well, in the past couple of years, well, 3 actually, things started to change. So data started coming out in Europe that started showing that, hey, wait, this maybe is a bad idea. Data started coming out showing that there was not necessarily any health benefits, mental health benefits from using puberty blockers or hormones in kids, and in fact that there were significant risks. And the studies came out in Finland, Sweden, and then Britain in the span of a couple years. The one from Britain being the CAS review, which was done in 2022. And all of these things basically said this is a mistake. And what happened is Europe basically hit the brakes on doing this. And in fact, the CAS review shut down the biggest transition clinic in the world, which was in London, I believe. And because of that, because of these new research papers coming out, people started going back and looking at this Dutch study, which was kind of just accepted as, oh, this is the Bible of what we should do. And then people started really finding a lot of flaws in that Dutch study. One, the whole study was funded by the drug company that sells the puberty blockers, which does, throw a little bit of bias in there. I mean, that happens where a company will fund a study, but it does raise some eyebrows. It had very few patients in it, around 50, had very, very short follow-up times. So the follow-up times were just a little bit more than a year, which to me, knowing what I know as a doctor, I'm not worried about, well, I am worried about problems in the short time, but I'm also worried about problems in the long term, meaning, do these people change their mind? What are the long-term effects of doing this? And they didn't really have that data. And then there was also a death in this study. One of the kids that was going through hormone therapies went to have surgery and died, and so that kid was just dropped out of it, and that wasn't mentioned in the original study.
Died in surgery?
Yeah, died from a transition surgery, yeah. And then also some of the research methods that were used were considered low quality. So suddenly this Dutch study, which was the end-all be-all of how doctors should treat gender dysphoria in youth, has come into a lot of criticism. Despite all of that, America basically didn't change course, outside of the political, criticism. Up until this year, when we talked about this a few months ago, the American Board of Plastic Surgery came out, and it's the first medical group to do it, and said, we don't agree with this. We're the ones that would be doing these types of surgeries, and we don't think that there's enough data to support the benefits and think that there's potentially a lot of harm.
Yeah.
So the shift is changing, especially in the past year or so, on the thoughts of using these type of therapies in kids. All right, so let's get back to the original story. So Dr. Johanna Olson-Kennedy, this pediatrician, medical director for Center for Trans Youth in Los Angeles, was given a $10 million grant by the NIH, National Institutes of Health, to basically try to recreate the study of the Dutch study, to look and see if the mental health of children with gender dysphoria got better if they received these puberty blockers and hormone therapies. And this study was done years ago, but it was just never released. The data was never written up as an article. And she just this past week or a couple weeks came out and said that the data did not support it, and we're refusing to publish it because we think that people will use that as evidence that we shouldn't be doing what we're doing.
That's exactly what it's for, though.
Yes, exactly right. Yes, exactly right. So I was flabbergasted when she said that.
The research the money we were given to do this research is showing the opposite of what we want, so we're not going to publish it.
That's exactly right. That's exactly what is happening. And it brings in so many questions because, she's the medical director of one of these facilities that does these things. And so, is this a personal conflict because of financial, or is it purely political? I don't know how this is acceptable. I mean, if the government's going to give you money to do a study, I feel like that
The government, that should be the property of the government, and the government should
I mean, I just feel
take
like
it.
you're obligated to release the results of the study. And then more than that, I mean, if you're doing a study to see if a treatment is beneficial or potentially harmful, and you don't like the results, I mean, and you withhold them, I mean, that's potentially harmful to patients.
Right.
You know, I mean, you have now other data out there that's showing that a lot of like really intelligent people believe that the risks outweigh the benefits. And if your study says the same thing and you refuse to release it, I mean, I feel like that you're not necessarily, you know, doing what's in the best interest of your patients.
Yeah. Well, to me, it's like her doing that is just the red flag of like, okay, well, this says more to me than reading the research article anyways. Her not releasing it.
Right. Yeah. I mean, I don't know. And I just feel like, you know, is anyone going to do anything about this? Like, or what can be done? I mean, I feel like
if the government gave the money to do the research, it's the government property. So it's
I don't
not
know.
even
You
hers.
might know. With your master's in health, you may know more about that. I don't know how that works. Like, if the government gives you a grant.
I'm only taking 3 classes so far, so I don't know
Okay,
anything
I
about.
won't tap you.
I don't know anything
Troubles,
about
you got
government
anything for us, man? I don't know. I don't want to
yet.
drag you in this if you don't want to.
But the government's heavily involved in healthcare, as you know. So it's like,
Yeah.
I don't know.
Any words of wisdom? I don't know. I think it's weird, right? I mean, I think we can all agree that this is weird, unusual.
I think once the kid gets to a certain, it shouldn't happen until the kid is at a certain age to be able to make that decision, and it still should go through the parents. That's just kind of how I feel.
Shoot,
about it.
whenever I got married when I was 19, I shouldn't have been able to make that decision.
Yeah, sure.
Well, I just feel like, I mean, it is
Like,
kind of arbitrary to assign an age of, okay, now you can make your own decisions, but we've done that. It's 18 years old. I mean,
Yeah.
at 18, you're
can-
considered adult. I mean, a lot of studies show that the brain isn't fully developed until like the early to mid 20s, and
Especially
so
men.
you're right. You know, and some people
Relax.
some people say that maybe you should wait until
That
then.
is the truth.
I mean, I personally think that all
The
right.
way it was said.
I think that if you're younger than 18, they shouldn't be able to do this. I worry about so many things about this, like
aren't
lawsuits.
Aren't most transitions done by men?
I
Biological men?
think that is higher I think you get a higher male to female than female to male. I do. I don't know the exact date on that.
Yeah,
Um,
that's the most time that's what I see.
And you're thinking that men develop or boys develop cognitively slower than women. I mean, I do agree with that. I think that that's pretty well established.
Emotionally too.
Yeah, emotionally.
They don't know how to.
Yeah.
They're like,
Yeah, I mean,
if I think one day that'd be kind of cool to be a girl, and then they think about it for a second, and then they're like, maybe I do want to be a girl, and like, you know, it's like
Right, and then they change their mind.
Yeah.
Yeah. I mean, that's one of my
Like
biggest.
they can't tell what's.
Yeah, I mean, to me,
what-
I think there's a lot of issues with doing these irreversible treatments, whether it be puberty blockers, hormones, or surgery on kids. But as I said earlier, I mean, one of my biggest concerns is how many of these kids, not necessarily in 6 months or a year, but in 10 years are going to absolutely regret that decision. There's tons of support group pages out there for people just like that are saying, I did this when I was a kid, you know, I didn't even know what I was doing, and now I regret it, and it's not really reversible to any degree of satisfaction. So that's my biggest gripe of it. Like the whole consent thing. I mean, you're already starting to see lawsuits pop up.
I wonder if those receiving any of those hormones requires any sort of mental evaluation.
Absolutely, yeah. The whole thing requires, talking with, a doctor, psychiatrist, therapist, all of that. It does require that. How much is done kind of varies, I think, depending on location.
Yeah.
Some people that are critics of this say it's, not enough. And some people think that the parents are kind of pushing this through. I mean, I do think that happens to a certain degree.
I think there's a lot of parents out there now that are almost think it's cool that their kid.
I mean, it's wild to
It's
say something like
different.
that, but I don't necessarily
I've
disagree
seen
with
it.
you. I mean,
It's almost like they brag about it.
Yeah, I'm still against this, and I know one thing I will say is when I first came out saying I'm against this, I was like the one person saying it. One, people don't want to wade into this. and two, there just wasn't as many people that I think were looking at the data. Well, now the data's coming out and saying that, hey, this might be a bad idea. I think you're going to see a shift on this. And I like to separate this completely from politics, because for me, it's like, I'm not even on the side of politics that's against this, because I'm really kind of in the middle. You know, I'm just strictly looking at this as like a doctor and thinking, there's some problems with this.
Yeah.
And you know, you see things like these studies come out of Europe, and then now you got this doctor in the United States that's refusing to release data because it says the same thing that the Europe data says. I mean, I don't know. I don't like any of it.
Well, I mean, manipulating any type of natural thing on Earth always comes with a cost.
It comes with a cost, right? I mean, but, you know, I mean, that's my business too, right? I mean, I manipulate appearances.
Yeah.
Yeah, you know, I mean, so, I mean, I think that, you know, you can get into like a trap if you say, oh, we shouldn't change.
Well, it comes with a cost. Like,
it comes with a cost, right?
And we always have bigger boobs, but I have a huge scar.
Yeah.
And now I have to get them done every
And I think the important
years.
thing is to be transparent about what those potential problems are.
Yeah.
You know, I mean, transparency is just critical for like good medical interactions, and I'm not sure that there's the transparency in this that there should be.
Yeah.
Yeah. So, well, anyway, if you listen to this segment, I'd love to hear your comments on it, and